Let's talk about what hernias are and where and why they occur.
All right, so hernias are actually defects in the tissues of the abdominal wall. And that's sort of a hard concept to grasp because we sort of look at ourselves and we go, well, how do I know this bump is a hernia or that bump is a hernia? And that's where we, again, have to go to your doctor and say, hey, this isn't right. When we talk about the groin, we're talking about the area down below on either side, just above your legs, essentially. And that's where most hernias become evident. But there are a number of other types of hernias.
So can you see a patient and just by looking at them know that they have a hernia?
Yes, in general, the diagnosis is a clinical one.
Okay.
You would examine somebody and you can almost always tell. Now, there are other testing modalities such as ultrasounds we use if we're not certain or if we want to be sure that there's not a hernia perhaps on the other side and that type of thing. But by and large, it is a clinical diagnosis. Okay,
I'm very fascinated by the next thing we're going to do, which is you've brought a trash can and you're going to show us how the trash can is basically our abdomen and how we can identify these hernias. This is a first here on the Health Channel.
All right,
we're using a trash can.
I'll tell you, we had to look far and wide to find a nice, clean trash can.
Right.
So we have a trash can here,
okay.
and I use this prop because it's very, as I said, it's a tough concept to get. But if you think of your belly like a trash can, so your abdomen holds everything. So your trash can, this is what gives it shape. It could be plastic, it could be metal, it could be any round or square, whatever, but the shape is held by the outside structure. Okay. On the inside, it has this liner. This liner is just a plastic sack that fits in this trash can or a different size trash can or a round one or any other shape. Your abdomen is very similar. You have a series of muscles that line the abdomen and they create the shape of your belly, whether you're big or small or shaped funny or however it is. Inside, you have something called the peritoneal sac. The peritoneal sac is, in fact, a bag that has all your intestines, just like the trash can has the trash inside the liner. Now imagine that I took and punched a hole right here. If I punched a hole right here and stepped inside this trash can, this sac would bulge right through that hole. And that would be what we call the hernia. Right. So the hernia is actually the hole. It's not what you see. People often say, oh, I have this hernia because I've got this bulge. Right. The bulge is the symptom of the problem. The bulge is not the actual.
The hole is the hernia.
The hole is the hernia.